Some pretty big news coming out in the last 24 hours as we are hearing that the United States is currently responding to a new deadly MPOX strain that is currently spreading. Now, I'm going to be sharing with you the latest on this, and also this we're hearing could be potentially a public health emergency. We are on the brink of this turning into a full-scale alert. I'm going to be sharing with you what it is the CDC and who is saying in the last 24 hours on this. And again, the United States responding. Now, as always, all of my articles are referenced, linked in the description below. I cite all the sources so that way you can see it's the latest. These all coming out in the last 24 hours. I'm going to get you caught up as to what is unfolding right now as we're hearing that the MPOX strain, which essentially is monkeypox, there is a new strain that they're saying is spreading, and it is deadly, especially to young children. And they're saying it is going further than they anticipated. I'm going to share with you what it is that they are currently saying about this. So, as always, before we dive in, if you appreciate the updates, do me a quick favor, hit the like button, even though this is not the news that we want to hear. And we also have wars taking place. We have elections coming up. We have a lot of conflict in the world right now. But if you appreciate the breaking news update, me keeping you up to speed on everything, just take a quick second for me and hit that like button. Just spreads this out further across the YouTube platform. Also hit the subscribe button to stay up to date. It's totally free. Why not? Also make sure that you are staying subscribed. A lot of people letting me know that they have been unsubscribed from the channel and have had to resubscribe several times. We're not really sure what's going on with the YouTube platform. We're thinking maybe they think that people are bots. Whatever the case is, make sure you're staying subscribed and that you have the notification bell on so that way as breaking news hits, you can be alerted. And also, in addition to the articles being referenced, as I cite all the sources just like a book report, so you can share this out with others, read it for yourself. I also have resources linked down below. Some of them are free. Some of them are things that you can purchase for you and your family if you want to be prepared for anything. So all of that is provided. Let's go ahead and get you caught up on the latest so that way you know exactly what is going on as this has come out in the last 24 hours. And all you need to do is Google search MPOX, as they are saying this is a new strain of the monkeypox. The CDC, who is responding to this, the United States is responding to this as they are trying to contain this outbreak that they're saying is unfolding. Now, this one coming out from Axios, and I've also got another one that I'm going to be referencing from The Guardian, and this one from The Guardian saying the head of the African Centers of Disease Control Prevention, or the CDC, has said that their agency is likely to declare a public health emergency continental as this spreads for the growing MPOX outbreak that is taking place. Now, Axios is saying the United States has responded to this deadly MPOX strain at this time, this coming out today. The Center for Disease and Control on Wednesday, yesterday, alerted doctors to be on the lookout for a deadly new strain of MPOX that is spreading throughout various parts of Africa, while the U.S. officials have committed $424 million to be sent over to the Democratic Republic of Congo, which is the epicenter of this outbreak that is spreading. The so-called Clade 1 virus is more virulent and deadly than the Clade 2 variant that caused a global outbreak back in 2022. The CDC alert came soon after the World Health Organization director said that he would convene an emergency committee to determine if this outbreak amounts to a public health emergency of international concerns. So again, we just went through that scare that we had with the COVID-19 outbreaks. Originally, we had heard that it was going to be contained to China, to where it had originally started. And we had heard no need for concern. This wasn't going to be spreading. And then after a while, it became a global pandemic that literally shut the entire world down. And so the concern is right now, there's still a little bit of scare or shock from what unfolded 4 years ago. And something like this now that we're seeing is spreading, and it is rapidly spreading faster than they anticipated with this new strain of the MPOX, they are saying is very concerning. And they're saying that this could become a public health emergency for international concern as it has spread beyond the original source, which is Congo. Now, Clade 1 hasn't been found outside of the Central or Eastern Africas as of to date, but the CDC said clinicians, they should be on heightened alert for patients who have recently been to the DRC or to any country sharing its borders with it. MPOX, previously known as monkeypox, has risen by 160% in Africa this year compared with 2023, according to the African Center of Disease and Control and Prevention. While most cases are in the Democratic Republic of the Congo, outbreaks have been reported in 15 other countries now. MPOX causes fever, chills, swollen lymph nodes, fatigue, and muscle aches, and can be deadly in young children and cause complications in pregnant people and in adults with weak immune systems. Due to the limited number of travelers and lack of direct commercial flights from the DRC, the risk of Clade 1 importation to the United States at this time, the CDC says they believe remains low. U.S. Agency for International Development announced on Wednesday that included 50,000 Jynneos vaccines and 10 million in health assistance, along with more than 170 million worth of agricultural commodities. So this is from the U.S. Agency of International Development. They announced this yesterday. Now, the health assistance will go towards a range of critical public health interventions in response to the MPOX outbreak in that region. The DRC has grappled with MPOX outbreaks for decades, but they lack the infrastructure to widely distribute out vaccines and preventative measures. Officials in June authorized the emergency use of two vaccines, Jynneos, made by Bavarian Nordic, and LC16 from KM Biologics. So that is currently coming out from Axios as they are responding to what is unfolding right now. And they're saying this is potentially on the brink of a public health emergency with what is unfolding. Now, here's another one coming out from The Guardian, and they're actually showing photos of the people with the MPOX, and their faces and their arms are just covered in what looks like spots, almost like chicken pox, but they're welts all over their skin. And it says warnings over a lethal and contagious strain of the MPOX as children in the DRC are passing. Alarm over high mortality and miscarriage rates as mutated virus spreads in the Eastern Democratic Republic of the Congo. So this is another article that has come out on this, and it says a dangerous strain of the MPOX that is ending the lives of children and causing miscarriages in the Democratic Republic of the Congo is the most transmissible that we have seen yet, and it could spread internationally. Scientists are warning this virus appears to be spreading from person to person, and it is through contact. Ranging between individuals, and they're seeing this spreading through children in various schools as well. So they're saying this is extremely contagious at this time. They are concerned about it. And I see somebody saying that it can spread in other ways, more personal, intimate ways that I can't say on YouTube. Yes, you are correct. I can't say certain things, but you are correct in that is another way that it is being it is being passed from one individual to another. So I will keep you guys up to date on this. This just coming out a little while ago. These articles today, as they're saying that we are potentially on the brink of a public health emergency announcement that needs to be made. Now, there are various articles on. Here's one coming out from The Hill, and it says the Center for Disease and Control and Prevention. They have issued a health alert in response to an ongoing MPOX outbreak in Central Africa involving a strain of a virus that is now causing more severe infections than normal. The CDC said on Wednesday yesterday that it was issuing a health alert to provide additional information about the current MPOX outbreak that has started in the Democratic Republic of the Congo. The current outbreak is more widespread than any previous DRC outbreak and has resulted in Clade 1 MPOX transmissions to some neighboring countries. The Republic of the Congo, which borders DRC to the west, declared a Clade 1 MPOX outbreak back in April, and there have been confirmed cases in the Central African Republic, the agency has said. So they're saying this is beginning to spread further and further to the neighboring nations, and they're starting to become concerned that this could become an all-out public health emergency. And as we read from Axios, the United States is responding to this, sending aid over, saying we are trying to contain it so this does not become an international alert public health emergency. There are two primary strains of clades of the MPOX virus. Clade 1 is endemic to Central Africa countries such as the Democratic Republic of the Congo. The 2022 global outbreak that impacted countries where MPOX is not an endemic, occurred due to infections of clade 2 MPOX, which is not as severe or lethal as clade 1. Now, according to the CDC, no cases of clade 1 MPOX have been reported outside of Eastern or Central African countries. The health alert advised clinicians to maintain a heightened index of suspicion for MPOX in patients who have recently traveled to the Democratic Republic of the Congo or its neighboring countries and are presenting symptoms of the MPOX. These include flu-like symptoms such as fever, headache, swollen lymph nodes, and characteristics of rashes. The World Health Organization director, he said on Wednesday yesterday that he planned to convene an expert group to determine whether the outbreak in Africa can be declared a global emergency. So again, right now we're hearing this is contained to the continent of Africa. It is originating in the Congo. We're hearing it is spreading through contact. It is going to the neighboring nations, and it is, they're saying, lethal to children. They're saying that this could be extremely dangerous for children. And they are saying, the CDC, who they are responding to this, saying that this potentially could become something larger. They are very concerned. We all have a little bit of, stress from what has unfolded from COVID over the past 4 years. We do not want to see something else like that happening yet again. So they are trying to do their best to contain what is currently taking place in Africa. The United States sending over hundreds of millions of dollars to try to help stop this, slow it down. Vaccines are being sent. They're saying it is being spread through to children, just through touch. This is a different variant than what most people are familiar with. They're saying there is clade 1, but there's also clade 2. The clade 2 spread that happened in 2022, they're saying this one with clade 1 is different. And they're saying that it is a lot more lethal and it is impacting children. So we are trying to get ahead of this and trying to make sure that it does not become what they said is an international public health emergency. But right now, the CDC and WHO saying we are on the brink of announcing that it is on that level. And as I mentioned, the World Health Organization director, he said yesterday that he is going to be convening with expert groups to determine whether this outbreak that is taking place right now should be declared a global emergency. So they are saying that they are trying to contain this, but they're concerned about this spreading out even further. Now, an emerging infectious disease advisor, Sylvia Jonchier, an advisor for Doctors Without Borders, who is based in the Domestic Republic of the Congo, told The Hill last month, and I am referencing The Hill right now, this is another article that came out today, that the strain that is spreading through the country, it does not appear to be more lethal, though it does seem to be spreading more easily from human to human. It is a characteristic that usually is seen in clade 2 infections, which again is the one that we had seen in 2022. Clade 1 infections typically spread from animal to human. So they are saying that this is going human to human, but it's not clade 2, according to this article. It is clade 1, which normally goes from animal to human. So they're saying they believe this is a new mutated variation of this strain. From what I'm reading here, it sounds like it is clade 1. And this clade 1 typically goes animal to human, but they're saying this is spreading rapidly from person to person, and it is impacting children. And it says that children are losing their lives as a result of this new strain that is taking place. So, as I mentioned, all of these articles coming out just in the last 24 hours, the vast majority of them coming out today. I'm looking at The Guardian, several from The Guardian, from Reuters, The Hill, from Axios, from NBC News. All you got to do right now is Google search monkeypox or MPOX. This is taking place right now. So they are trying to contain it. And again, they're saying that it was in the Congo. It's been there for a while. They've had an outbreak, but now the concern is that it is starting to spread to the neighboring countries much faster and much more deadly in children than they had anticipated. Not significantly more for adults. And right now, the United States, we're hearing in the last 24 hours, has responded. Now the CDC and WHO, they are responding, and they are saying that we want to get ahead of this and contain this so that we don't have another global pandemic take place like we saw with COVID-19, trying to get ahead of it, trying to cut it off and stop any further spreads, sending over 50,000 doses of vaccines to Africa to try to make sure that they can try to slow down the spread of the MPOX and not have this become something bigger or larger But at this time, as I mentioned to you, the World Health Organization director is currently consulting expert teams to determine if they should announce this a global emergency at this time. So we will see. I will keep you guys up to date on everything. Now, also do me a favor. I see we've got 2,568 people live with me in the room. If you guys appreciate the updates, please take a second and hit that like button. Literally only need 30 more likes to help get 1,000 likes, which just spreads this out further so that way more people can get the latest updated information. And also, in addition to that, as I mentioned, I see somebody saying that they don't believe it. They think that I'm full of baloney. That's totally fine. I cite all of my sources and everything I read and I reference. It is linked in the description below. Go ahead and check out the articles for yourself. And just so you know, so none of this is coming from me. This is me referencing stuff like a book report. I try to hold myself accountable to my community. And also, if I misread something or anything, you can check the articles. You can see it. You can let me know. I make mistakes too, but I just want to make sure that you guys are getting the latest, as this has just come out in the last 24 hours. Stuff coming out from the CDC, from WHO, these announcements coming out. And then today, these articles coming out across the news outlets, from The Guardian, from Reuters, from Axios, NBC News, from The Hill. These are cited for you guys. So I will make sure to keep you guys up to date on this. Now, if we have any more updates, if this develops further, like I said, I will be sure to keep you guys up to date on what is happening with MPOX, formerly known as monkeypox, which we're hearing is spreading rapidly in the continent of Africa. The United States now also sending over massive amounts of support financially, and also sending over 50,000 vaccines to Africa to try to get ahead of this, to try to contain it. And we will see what unfolds tomorrow, because we're hearing that it could be tomorrow. As soon as tomorrow, we will see that the announcement could come out that this could be a public health emergency, a global emergency alert for the monkeypox. So we will see. I will keep you guys up to date. And like I said, articles linked in the description below, resources linked in the description below. Take a look at these articles and look at the pictures. It looks like it is extremely painful. People's skin just covered in these bumps. Looks like the chicken pox. I'm not sure. It looks like bumps about the size of like maybe a pinto bean all over their skin, their face, their arms. Very sad. I'm seeing pictures of doctors looking and inspecting small children's skin. So hopefully they can get ahead of this. They can slow it down, and they can stop this from becoming a larger outbreak. That is the hope. And I will keep you guys up to date. Now, in addition to that, I know a lot of people want to know what's going on with the war in the Middle East. There's stuff going on with Ukraine attacking Russia. They are now taking ground on Russia as of today. In addition to that, this morning we heard that there was a 7.1 magnitude earthquake in Japan with tsunami warnings that came out. No tsunamis from what I read unfolded from that. And also we had a news conference happen with former President Donald Trump today at Mar-a-Lago. I recorded that for you live. If you want to check it out, check out my channel. And we're hearing that there is just a lot unfolding news coming out, that there's going to be 3 debates between former President Donald Trump and Kamala Harris in the month of September. I believe the first one is either the 4th or the 10th. I can't quite remember, but I will keep you up to date on those. Make sure that you can see it. There's going to be 3 debates we're hearing that have been approved. They just got to work out the details in the month of September between Trump and Kamala Harris. So a lot unfolding. I will keep you guys up to date every step of the way, and I will cite all the sources, keep you guys in the know. Do me a favor, hit the like button if you haven't done so yet. Hit subscribe to stay up to date. I'll keep you up to speed on everything. And you guys, thank you so much for joining me. Take care. Have a good night. God bless. And I will catch you in the next one. This is Steve.